Thank you very much. And look, I would also like to, I've had a few days off, so I'd also like to acknowledge, as well as the traditional owners of the lands upon which we're all gathered here today, and pay my respects to their elders past and present, and those who are emerging as well. I'd also like to acknowledge the hard work that my colleagues have done in my few days off, because it's been a tower of effort from a number of people who've been working incredibly hard over the last couple of days since I last spoke to a community forum, actually last Wednesday. I'd like to acknowledge the work of my colleagues there. So look, just for an update on where things are at. So in terms of the Holiday Inn outbreak, in total, we now have 16 cases. That includes the 3 original index cases that had travelled into Australia from overseas, and then a further 13 cases that have been from various degrees of spread in relation to that. Still very much related to spread within the context of the Holiday Inn, so people who have either worked at the Holiday Inn or have been residents at the Holiday Inn site, and quite well linked in terms of the movements of the people, so from an epidemiological perspective, but also in terms of the genomic testing that we've been able to do. We've been able to show that these are very, very, very closely related strains, many of which are identical, showing that we can be very confident that the spread is all linked to that particular setting. That's actually for 13 of them. There are just the most recent 3 that we are still waiting for that confirmation. So that's actually very reassuring. Most of the spread outside of the Holiday Inn is linked to close household contacts. So they are people who are within the households of confirmed cases. Again, you don't want to see anybody getting coronavirus, but from a public health perspective, those household contacts are the least concerning, because really you do expect to see that. And usually they become infected once they've been, I'm going to say locked down, which isn't a very nice way of saying it, but placed into quarantine, and so therefore aren't out and about in the community spreading it any further. I'm sure people will be aware that we do have one site that has seen some spread outside of that context, which is a site at a private function out in Coburg, where there was a gathering in that setting, and we have now seen 3 cases that are linked to spread at that setting, but are all linked back to a primary close contact, so a primary case who we know was exposed and contracted the virus at the Holiday Inn. So it is all still very much related to that Holiday Inn exposure. And that particular exposure was very, very unusual. It was incredibly early, much earlier than we would have expected. So quite unusual for that exposure, and isn't the sort of thing we would usually see. But we're now very confident that everybody in that setting has been quarantined. They've all undergone at least one round of testing, and we are doing quite regular testing on that particular group to make sure that we've got, sort of all the I's dotted and all the T's crossed, and we're not missing any other potential exposure sites. One of the interviews for one of those most recent cases hadn't quite been completed and is still being worked through, and there will be a couple of tram rides, quite short, as new exposure sites related to that particular case that will be popping up on our website a little bit later today. So as we always do, I would encourage everyone to pay attention to the exposure sites on our website. They do get updated regularly as we get more information coming in, as we check through people's phone records and things to understand exactly where they've been. So checking in regularly, making sure you're across those exposure sites, and so that people are aware to quarantine and get tested as is required. And as we say to everyone, and has come up particularly in relation to the community concerned around the Coburg outbreak, there are concerns around various community events, and we have followed up everything, but we do like to remind everyone constantly that at the first sign of symptoms, please do go and get tested. That's really important, so that we can jump on anything as soon as it arises, if that's the case. So really, that's an update of where things are at in terms of the outbreak as it stands. So I might pause there. I don't have very long this afternoon, so I do want to allow some time for some questions, and I'm not sure if there was someone else to speak after me, Mia, so I'll throw it back to you.
Fantastic. Thanks so much, Simon. I do have a couple of questions, one from Fiona Power. And if we do a couple of questions, Simon, then we can let you go. And then we've got Jerome also with us, so he'll be able to speak as well. So any questions for Simon, if we do those now? Fiona, would you like to ask your question?
Yeah, sorry, just quickly, just with the requirements with aged care for transfers to and from hospitals, are there any positive case cases in hospital at the moment? And if there are, do we know which hospitals that may be?
Look, I don't have the definitive numbers there, and Jerome might have some more detail. We have, I think, off the top of my head, apologies, I don't have the exact number, about 20 positive cases in Victoria. I actually believe only one was in hospital and may even have been transferred out today. So that
Simon?
Yes?
Right, we've got 20, so it's Jerome here. It's 21 active cases in Victoria. There are none currently in hospital.
Thank you.
Thanks so much. Mark, you've got a question for Simon? Mark, do you have a question?
Unmute. Yeah, can you hear me okay now?
We
Yes.
can, thank you, Mark.
Doctor, I've been studying this quite extensively. Why are we wetting the bed for a virus that's got a greater than 99% recovery rate?
So this is a virus. I'm not quite sure I quite get the beginning of the analogy, but this is a virus that we have seen in many countries all over the world have very, very large numbers of infection and very large numbers of severe illness and death associated with it. You just need to look to the UK and the US, which are countries that we could get a lot of news out of, and just see the many hundreds of thousands of cases and the many tens of hundreds of thousands of deaths actually across the world linked to this virus. And if we don't go hard and we don't make sure we lock it down, we could be in a similar situation here in Australia, particularly this particular outbreak that we're looking at, which is one of the variants of concern, which is one of the more newly emerging strains of the virus, where we're not only seeing a more infectious virus with more people getting infected, we're also seeing more severe illness, and still don't really fully understand what the implications of this virus are going to be in the long term. So I understand that for the vast majority of people, when we only see a handful of cases in Victoria, and you're not seeing it every day, it seems like we're doing a lot of effort for not very many cases. But I think the alternative would be to be in a situation like the UK or the US or Europe or many other countries around the world, where it really has been very devastating, and not just impacting those people with the virus, but also having flow-on effects into the whole of the health service, where you see a lot of impact on ICU and other health services available. So I think it's certainly the right approach to ensure that we can hopefully get through this 5-day period, open up again on Wednesday, and we can all go back to doing pretty much our normal everyday things, which is a luxury that many people around the world aren't able to have at the moment. So it does make it worthwhile.
Great. Thanks so much, Simon, for that response. One more question here from Charles Cisse. Charles, go ahead.
Okay, on mute. Sorry. What's going to happen? Can you hear me now?
Yes, we can.
Okay. My question is, what's going to happen after the 5 days lockdown if this virus is not contained somehow? Is it going to be extended? Is the lockdown going to be extended, or what's going to happen? What's the next step after the 5 days lockdown? Thank you.
Thank you, Charles. And look, I might start and then hand over to Jerome to pick up the rest of the answer. So look, Brett Sutton, our Chief Health Officer, is paying very close attention to how the response is flowing out into the community. We're still in the fairly early stages of the lockdown, and we are quietly confident that we are getting our arms fully around this and really controlling it. And we still aren't seeing spread in community settings outside. So we're still very hopeful that it will just be those 5 days. We still have more test results to come in. As I said, we're going to be retesting a number of people at this private function over the next couple of days. And if we get to that day 5 period and we're not fully confident, then we might have to have another think. But I might throw over to Jerome to touch on what might happen at that stage.
Right, thanks, Simon. And yeah, Jerome Weimer here, one of Simon's colleagues in the COVID response. Look, I think our expectations at the moment are that the 5-day the reason for the 5-day lockdown, and it's something that we've obviously had to do with a heavy heart. It's not something that any of us want to be doing and asking Victorians to lock down for 5 days. But it's really the purpose of it is to slow down connections between people. We need a break. We need a 5-day break to slow down the number of people meeting, connecting with other people, because we believe this virus, we've already seen it move very much more quickly than all of our previous outbreaks over the last year. That we are concerned about it really running far too quickly if everybody's still moving around with a huge number of contacts. And I think I'd highlight that by saying we've only got, at the moment, 16 cases, 16 cases. Of those 16 people, 5 of them are in hotel quarantine, so they're not contacting anybody. So the 11 people have got over 1,000 primary close contacts. That's the escalation. So we've got over 1,000 people in 14 days of lockdown. We've got 1,500 people on top of that who walked through the airport where there was a positive. So it's 2,500 people locking down for 14 days because of just essentially, 10 cases, 10, 11 positive cases in the community. So that's why we've asked for the lockdown. That's why, as Simon says, we need to, we've got more work to do over the next 2 or 3 days around the cases we're aware of, the new cases we've become aware of in the last day or so. So one with a connection into childcare, into the swimming pools. We're pretty confident now that last time we spoke in this group, that the Sunbury exposure sites have been pretty much dealt with. We've got no positive cases that we're aware of outside of that original ring that are already locked. We've still got some concerns about the wider Coburg area. And look, we just need people to come forward and get tested over the next few days. If we see really high testing numbers for the next 2 or 3 days, 20,000 plus, then we'll be more confident that we will detect any other possible change of transmission. That's the only way which we can be confident. And if we don't see people coming forward, then we'll be very concerned about the virus spreading underground. And without being hysterical, that's really what we saw in May of June of last year, is that the second wave started because it was all going underground and it was undetected transmission because people weren't coming forward to get tested. We were 7 months ago, 8 months ago. If I look at the scale of and the sophistication of the work that Simon and his team does, it's lightning years away. And as Philip has said at the beginning, we have a much stronger partnership with so many other community health services and primary health services and others around the place. So we're much more confident of getting this to ground, but that's what we need. What happens after Wednesday night will depend on how confident we are that we have no other undetected change of transmission out there. And we'll make that judgment, or Brett Sutton will make that judgment on Wednesday, and obviously inform government. There will, I think, be other decisions for government to make at that point around international flights coming into Victoria. So we don't have any new international arrivals after today for the next few days. We'll have to make a decision on what happens to that program. And we'll have to make a decision if we ease off restrictions, what we ease them off to. And again, that'll be a decision that Brett takes on advice, I think, on Wednesday. Back to you, Mia.
Thanks so much, Jerome. There's a really good question in the chat, and I might just ask that. And the question is, of the 21 cases, and I think actually, Jerome, you might have pointed out that it's a bit less than that, are they all traceable back to quarantine, or is there a community case with no identifiable ground zero? Are we trending up or down?
So really good question, really simple answer. So we currently have 21 cases. 5 of them are cases of arrivals into hotel quarantine that have not spread to anybody. They're just people sitting in hotel quarantine, serving out their infectious period. Of the 16 that are left, they are all related to the 16 cases we're talking about as the Holiday Inn outbreak, are all related to each other. We've done genomic testing, which shows that 13, 14 of them are all directly related to each other. And the most recent 3 cases are very closely connected in as well. Will be available in a day or 2. Of the 16 cases, then 5 of those 16 are amongst hotel quarantine residents. So 3 people arrived together in a group as a single family group. They all brought the virus with them from overseas. So that's 3. There are 2 other residents in hotel quarantine that it was transmitted to within the hotel quarantine system, and that is clearly a problem for us. So that's 5. We then have 4 staff members who worked around the Holiday Inn, so people who worked in the hotel quarantine system. Those 5 contracted it from the family of 3, so that's now 9. And then the remaining 7 of 16 are household members of those staff members. So the 4 staff members transmitted it to people who are living in their household, and in the last step of this chain, we have one of those CQV staff people who went to a party in Coburg on Saturday and transmitted it to some of her friends and social contacts. So all those 16 cases are related, and we have a very clear understanding of where they are. Every single one of those people is isolating effectively and safely. We have 100, this morning lunchtime, we had 129 really cold and work contacts of those 16 people. They are all quarantining, they are all isolated, and apart, we have negative test results for 127 of them. 2 of them we're still waiting on, and all of them will do their 14 days of quarantine. Mia.
Great one. Thank you so much, Jerome. We've just got another 8 minutes with Simon. He has another meeting at 3:30. There's another really good question here. Of the 21 active cases, how many of those reside in Sunbury?
1.
Great. And one for Simon, maybe. Can this new COVID variant be transmitted in cooling systems? Could this possibly be what happened in the hotel quarantine outbreaks?
Dr. Crouch.
So look, I think the answer to that question, and as I alluded to in one of my earlier responses, is the new variants. There are 3 new variants of concern, actually. The one that we're dealing with, this particular one, is the B.1.1.7 variant, which is known as the UK variant. We're still finding out a lot about them. Early indications suggest that it's got a higher hit rate in terms of spread to household contacts, so therefore making it more infectious. There have been some suggestions that it has a shorter incubation period, so that's the time from when someone is exposed to becoming infected. There is early evidence to suggest that when people do get infected, they have a more severe illness. Beyond that, it's not entirely clear yet as to the other sort of transmission dynamics of this virus. We've talked all along about COVID generally being spread by droplets, so that's requiring somebody to cough and generate droplets, and those droplets to contaminate a surface and be spread that way, and not really be spread by that airborne route. Now, we've known that there have been exceptions to that for a long time. So if somebody's undergoing what we would call an aerosol generating procedure, so something that then turns those droplets into a fine mist that can suspend in the air, then it can have more of that lingering in the airborne type situation. And that's what we think has been the situation here with the use of the nebulizer. It's turned it into those fine particles that can suspend in the air and travel more that way. So we do believe it's more linked to that aerosol generating type activity, and that allows it therefore to perhaps be wafted out through a door if the door is open or whatever. There is always the option for airflow systems to be involved, and I know that our colleagues in the quarantine program have done a lot of work looking at the airflow in the hotels particularly, but that is something that needs much more work, I think, with these variants to better understand the potential spread through cooling systems or other ventilation systems in buildings. So it's certainly a possibility, but it's not something that we fully understand. And when I say we, I don't just mean us here in Australia, but I mean we, the scientific community around the world.
Great, thank you so much. There's a question here, Simon, and this might be a good one for you. Someone has asked why Sunbury Square wasn't listed as a hotspot until Thursday. And my memory is that we had some really great feedback from the community on Wednesday night that you, I think, took on board. Is that?
Yes, that was part of the input. So what we do with every case is when we do an interview, we gather the information, we find out where they've been, how long they've been there, and work through a risk assessment process to understand what the exposure would be. And generally speaking, somebody walking very briefly through a setting wouldn't be the type of exposure that we would list as an exposure site, particularly when they're wearing a mask. And these were all, some of these were some assumptions that we were making about the setting there. And I think I noted on the Wednesday night meeting, clearly you can tell I'm not a local to Australia, let alone Sunbury, and so didn't have any knowledge personally of that site. And so partly based on some of the feedback we got at the forum on Wednesday, where we got I got a better understanding of the nature of that setting, the proximity to the food court, the way the shops are set up in that particular area. We felt that it was probably appropriate and prudent to just raise a little bit more attention to that setting, not make it that tier 1 requirement of test and quarantine for 14 days, but to provide a little bit more awareness to the community there, so that we really were covering all bases. As I said in one of my earlier answers tonight, we do really want to make sure we're not missing anything. We don't want to end up in a situation like we've seen overseas, and so I think it was appropriate to take that, which is really a very, very cautionary step of naming Sunbury Square, but was probably appropriate based on some of the feedback and the further risk assessment we were able to undertake as a contact tracing team.
Thanks so much, Simon. And we've got one more question I'd love to squeeze in before we need to say goodbye to you. The question is why some cases are positive and negative again, and then positive as per the Herald Sun?
That's a really good question, and it's very frustrating for us as contact tracers trying to unpack what does that mean in terms of their infectiousness. And again, we do have to draw on some of the work that's been done internationally and the understanding of the dynamics of this particular virus. So what we do find with a lot of viruses, actually, not just with coronavirus, is that when somebody is infected, they can continue to shed viral particles for quite some time after they've been infected. And some viruses, it can be for a very long time. Again, depending on the different virus, those virus particles may or may not be infectious. And so what we've been able to find from research overseas and locally is that after about 10 days from when you were infected, started showing symptoms, those viral particles are no longer thought to be infectious. So they could be dead viral particles or virus particles that are sequestered somewhere within the body. And so we do find that sometimes people do shed those viruses, for weeks or even a few months after their initial infection, but we have not yet seen any of those people transmit the infection to anyone else. And so you do get this odd sort of pattern of they might have a weak positive today and then a negative for a few days and a weak positive the day after. And it can be quite frustrating for us because every time we get a positive, we do have to thoroughly investigate it, and we do thoroughly investigate every positive result. But we do bring together an expert review panel of public health practitioners, infectious disease experts, lab technicians, etc., to really understand what that result means. And we can almost always clear those people of having infectious virus, which is good.
Fantastic. Thank you so much, Simon. And really thank you for being here today. We appreciate your time.
Thanks very much. Bye, everyone.
Thanks. I have a question, and this is for Jerome. There's a couple of questions in the chat about a document that seems to indicate that the lockdown is going to actually go for longer than just 5 days. Could you explain that for us?
I can, and thanks, Mia. So the state of emergency, which still exists in Victoria, and of course it's been in place since March of last year in various guises, is currently 26th of February. That is the kind of the underlying legal framework that we use that essentially gives the Chief Health Officer power to issue directions on things like requiring mask wearing or all sorts of other restrictions that are in place. The additional directions that we issued on Friday midnight, which puts us back into stage 4 lockdown into the 5-kilometre restrictions and so on, are issued under the state of emergency. And the convention that we use when we issue directions is that they run until the end of the state of emergency. The state of emergency has to be renewed with Parliament's approval every month or so. So it is always emergency that happens to be the 26th of May. We have made a very clear commitment publicly. Both the Chief Health Officer has made the direction very clearly only until midnight on Wednesday, and the Premier and Government has reiterated that this is until midnight on Wednesday. And there will be further announcements on Wednesday around what happens next. So there is our public health advice is we need a 5-day lockdown that runs out till midnight Wednesday, and government has backed that advice.
Thanks so much, Jerome. A good question here about community. And the question is, what assurance do we have that people who are being asked to isolate are doing the right thing? Maybe you could also talk to the supports that the department offers for people who are isolating.
Sorry, Mia, you broke up on my line. Could you restate the question?
Sorry, Jerome. Can you hear me now?
Yes.
Yeah. Just what assurance do we have that people who are being asked to isolate are doing the right thing?
Yep.
And maybe also we could talk to the supports that are offered for people who are isolating
Yep.
at home.
Yeah, look, so like as I said earlier, we have currently about 2,500 people across Victoria who are isolating because of this holiday inn outbreak, which means they're locked down. They're required to get tested, and we phone and we connect and talk and phone those people on a regular cycle. Not every day, but every few days they'll get a phone call from one of our people, to primarily as a health check-in. How are you feeling? Do you have any symptoms? Do you need any support? And there's a range of financial, emotional, and healthcare support available to people who are undergoing lockdown. So if people are concerned about, I've got a positive test, I can't isolate because I've got welfare, I've got children who are dependent on me, or parents or other people I look after, or I've got a whole load of other things I need to do, we can provide that support to you. We can move you into we can provide support to people you look after. We can put you into frontline work accommodation. There are a range of options available to people. There is also financial support available to people, and there are things like, simple things like food and welfare relief available, which can be culturally appropriate depending on people's needs. So we're really conscious that asking or telling people you need to isolate for 14 days in your own home is a really hard thing to do, and for many people that is a challenging physical, mentally, and welfare thing to do. So a range of support is provided, and we would ask people to reach out to us as part of health to access that support. And Philip and other amazing in broadening that support. And we know that certainly for some communities that there's a whole bunch of other organisations that spring out of the woodwork and that provide such amazing emotional and practical support. So there is a whole host of things available. I'm not pretending for a moment that makes it all easy, but there is a huge amount of support available from the state in its various guises. What we also do is we do door knocks. So we do check up time to time to make sure people are where they say they are. So our friendly authorised officers, who are health authorised officers, will pop round, and we do around 300, 400 visits a day, people to make sure they're going okay. Particularly people who we haven't heard from. If we're phoning up or we can't get hold of them, then we'll pop round and just make sure that people are able to do the right thing. And what we almost overwhelmingly find is that people do the right thing, because most of us understand how dangerous this virus is, and the implication of people who are primary close contacts, and our presumption with anybody who's a primary close contact is that they are incubating the virus. That is our assumption. So they are, if they're not positive now, they're going to be positive at some point. That's our approach that we take, and therefore we really tell people, if you're in that, if you go out and about and see people who you like and love, then the only people you're endangering are the people who are closest to you. Please just don't do it.
Thank you. I'm just fending off a minor attack here. I've got a couple of questions in the chat about vaccinations. One question particularly about supported residential services, and another question about when will we all be vaccinated. Jerome? Yeah.
Yes. Good luck. Good luck with your own care and management responsibilities, Mia. Vaccination. Look, the Commonwealth Government has around 10 million doses of the Pfizer vaccine that is due to arrive here in the country this week, so the week coming, which is hugely exciting for all of us. And we're intending to start vaccinating next week on a combination of the people who are most exposed to COVID, so people working in the hotel quarantine system, for example, as we've seen over the last week, as well as frontline health service workers, but also aged care residents. So there'll be a big focus on protecting people in aged care, because we know that they are the most vulnerable in terms of the negative impact on COVID. So the program of vaccination will start with those who are most exposed and those who are most vulnerable. The numbers, I have to say, the numbers will be quite modest. It'll be tens of thousands a day rather than hundreds of thousands a day in the early stages of the program over February, March and April. We are expecting to receive the AstraZeneca vaccine which is manufactured here in Melbourne. We are expecting to start to receive that in March or April, and then we will start to move into a much bigger volume vaccination program, all prioritized around those who are most vulnerable and most exposed. So bluntly, you know, the older you are and the more comorbidities you've got, the higher up the pecking order you are. Young, and we are not vaccinating children, I think, under the age of 18 or 16 at this stage. But that is, we expect that to take, you know, I'm looking at an 8 to 9 month program before we've really completed the full rollout. That's kind of the expectations we have at the moment.
Great, thank you so much. I'm conscious Marissa has had her hand up for a long time. Thank you, Marissa, for being so patient.
I'm okay. I'm okay now. Can you hear me?
Oh, great.
Yeah.
No
Yes.
question? Okay.
I was the one who asked about the cooling system.
Oh, good on you. Thanks so
Yeah.
much, Marissa. Great job.
Thank you.
Okay. Another question in the chat, Jerome. Does the tennis player who has tested positive after leaving Australia cause a problem for the Australian Open?
The short answer is no. The tennis player has since clarified on the authoritative voice of Twitter that he tested negative on the 9th of February, which is the day he left Melbourne. He stopped over, he did a flight to Doha and then stopped over in Doha and then flew on to South Africa. He tested positive in South Africa. We don't know what kind of test, but he's confirming to think that he contracted the virus in Doha or on the flight. It has no impact on, so we're following the case through there's a national incident room that talks about these things. If I'm really honest, and I won't go on, you know, if I'm really honest, I think it's not an issue for us. Somebody who traveled from the Middle East to South Africa got COVID. It's far more common for that to happen, and I'm sure the South African health authorities will deal with it. We see no connection back to Melbourne.
Great, thank you so much. There's a question in the chat about international arrivals, so people coming to Melbourne and the risks associated with that. It's a tricky balance. Do you want to talk to that?
Yeah, look, I think we've all seen that play out very much in the last couple of weeks. We've been taking a fairly small number of people, well, you know, smallish number of people into hotel quarantine. We had around, I think, a peak of around 2,000 people in hotel quarantine at any point in time. Again, my numbers may not be 100% accurate, but I think we have something like 8,000 or so people who have come through hotel quarantine since the 7th of December when the program restarted. But we've seen now a number of leaks of the new UK variant from hotel quarantine over the last 10 days. That is hugely challenging. The international flights have stopped as of today. So we're arrivals at the moment with the 5-day lockdown. The government has made it pretty clear. It's clearly not in my space, but the government has made it clear that they are reviewing the implications of carrying on with hotel quarantine, and it's clearly a very difficult judgment. We know that clearly there are still a number of people, Australians living overseas or who are overseas, desperately trying to get back into Australia, and we understand why that would be the case. Equally, we're starting to see that the very real risks of people coming from overseas, and maybe, you know, it is, yeah, we only need to look at our TV. We are absolutely, you know, here we are in a lockdown because we're worried about 16 cases, only 11 of which are in the community in any real way, and we're going into a lockdown. The rest of, you know, where I'm from, you know, where my family are in Holland, Northern Europe's been in lockdown for most of a year in various ways, shapes, or form, and we've got thousands of cases and thousands of fatalities every, you know, on a very regular basis. So the level of transmission, the level of infection in really the rest of the world outside of Australia and New Zealand is just exponentially higher than anything we've seen here, even in the darkest day we all went through last year. And therefore the risk of people coming from that environment into our environment is acute, and it's a real challenge for us. And I think we all want to believe that we can manage those risks in a way that it doesn't negatively impact the Victorian community. I think what we're all going through now highlights how very difficult that is. This is a very dangerous, fast, scary virus, and managing this kind of quarantine system is a risky undertaking.
Thanks so much, Jerome. I'm just conscious that Justin O'Brien has a question, and there's a really good question in the chat about children and mask wearing. I just want to follow up though on the comments you just made with another question about why we wouldn't do hotel quarantine in regional areas. And we did talk to this one the other day. So why wouldn't we move our hotel quarantine system to somewhere outside of Melbourne?
Look, I think all those questions are being reopened at this very point in time. So I think let me turn it around the way. The reason we put hotel quarantine Mark II in the CBD or in the city, in the metropolitan area, is that these are essentially health facilities. A lot of people coming from overseas are coming with pre-existing medical conditions, and also we know that quarantining is a very challenging mental health. It's very challenging to people's mental health for understandable reasons. And therefore, there's been a big focus about having good medical support available to people working in hotel quarantine, and the good medical infrastructure to deal with this number of additional people tends to be in large urban areas, which is why Sydney, Perth, Adelaide, etc., all have hotel quarantine in their CBD areas. I think the other challenge is that we've got 3,000 frontline staff, ranging from nurses to food and beverage workers, ranging to security, who work in the hotel quarantine system and who want to go home and see their families at night. I think we'd all rather live from home rather than live in the middle of nowhere, away from our families. So that is a problem. Now, it is absolutely, I think we are again revisiting. Well, do you do a fly-in, fly-out facility in a remote area? It is possible, but the practicalities of that are also huge, because we then have to find a workforce that is willing to fly in and fly out, and all the challenges of decompressing people from fly in, fly out. So I think at this point in time, I think we're all taking stock and saying, what should we really do? And government will cogitate on that while we try and put this outbreak to bed.
Great, thanks, Jerome. Justin O'Brien, you've got a question?
Yeah, my mum, when we had a meeting like this before, my mum kept putting her hand up and she didn't have a chance to be questioned. The question is about the Dump Square air conditioning. Will that be, because she wants to know, will that be caught for the virus or something? Because people could walk in the Dump Square and keep but sometimes the air conditioning can be like for the Dump Square. That's what she wants to know. So have you got an answer for that?
Yeah, Justin, I do. Sorry, the one thing you're breaking up a bit on my machine. It might be me, it might be you, I don't know. Are you talking about Sunbury Square, the air conditioning, or somewhere else?
I think
in the Sunbury Square area.
Yeah, Sunbury Square area. Yeah. So look, I think the view what we know about the virus is that when you're outside, the risk's way lower of transmission. So people working in outside environments, very low risk. People in inside but open spaces like large shopping centres, higher risk than being outside, absolutely, but not as high risk being in a small room. Being being at home in small rooms with people we love and offer no air conditioning, most of us, is the highest risk of all. So it's kind of a spectrum. We think that we are concerned about air conditioning systems and air circulation systems in places like aeroplanes and in places like the hotel rooms with the hotel quarantine system. That's getting a lot of attention at the moment. We're not concerned about shopping, big open public or big public spaces because of the frankly the size of the space and the very low chance that somebody with COVID is actively in the area. And again, we had one active person, or we found one positive case who lived in Sunbury. We know she'd made some movements, but again, we've not found anybody who was close to her who was positive. So therefore, the chances of people who are not close to her but who had adjacent contact in Sunbury Square is very, very low.
All right. Yeah. Thank you.
Thanks so much, Justin. That was a really good question. Thank you. There's a couple more questions about vaccinations, and I'll try and kind of cover some of those. So one of them is there is a concern in the community about how safe is the vaccine in light of a death in Norway and some problematic cases in the US. So how will you explain this to the Australian community and I guess allay fears about vaccination in Australia?
Yeah, no, thanks, Mia. And of course, Simon Craig, I'm not a clinician for the, but look, if you look at vaccination, and I think the experience, one of the I guess benefits we have of being a little bit further back in the vaccination program is we can see exactly what's playing out in the rest of the world. And if I look at the UK and if I look at Israel, who have gone really fast with very swift vaccination programs, with 20% of the population in Britain and I think 30-40% in Israel, that's gone. The deployment has gone really well. We know that the vaccine essentially produces an immune system reaction. That is its job, to generate for the immune system to generate the antibodies to give you some protection from COVID, from a full-on COVID infection. I feel a bit like the flu jab. You may feel a little bit poorly for a couple of days after that. There is about a 1 in 4, I think, chance of people feeling a bit off color immediate for a day or two after the jab. And there'll be some medical doctors on the call, I'm sure, who can put this better than I can. But the vaccine, if you look at the entire world has been working on developing a safe vaccine for COVID. We have 4, I think, contenders out there, 2 of which are now approved, and others coming through. We have millions of people being deployed. There will absolutely be cases where people with comorbidities and with other health challenges having reactions to a whole range of things. So it is entirely possible that incidences of people who will have other preconditions and other immune system challenges reacting badly either to the vaccine or to something else that might be happening at the same time. But all the research we've seen, and more importantly, the Therapeutic Goods Administration, which is the regulator here in Australia, that's their job, to put all those checks and balances in place and say, is this vaccine safe to use? And I think, I'm not going to debate it for long. There is an overwhelming body of evidence that says it is a safe vaccine. There's an overwhelming body of evidence that says, hundreds of thousands of people have died from COVID in the last 12 months. This is in the nicest possible. I absolutely understand that there will be individuals, hopefully a very small number, who will have concerns, and we will work very closely with our primary health physicians and with primary health networks to really explain and address any reservation that people may have.
Great, thank you so much, Jerome. And I'm sure the vaccine conversations will continue for many months to come.
Absolutely.
We've got a couple of hands up. Mark, do you have another question? Maybe not.
Unmute. Is that better? Can you hear me now?
That's better. Yes, great. Thanks, Mark.
Minister, with all due respect, this is the second time that this virus has escaped hotel quarantine. What can you say to Victorians who want to trust the government to be able to do the right thing?
Yeah. Look, Mark, I think it's a very, very fair, thanks for asking the question. That's a very, very fair question. Look, it got out of hotel quarantine. Look, I think we've all learned. I think we've all implemented a huge amount of work on the back of the first hotel quarantine system. There was many investigations and reports. And if I look at the system of hotel quarantine that relaunched on the 7th of December, the level of detail and got into it, the level of training that's got into it, the amount of money we've all spent on it has been absolutely huge. I think the risk that what we've learned over the last 7 days, 8 days, and what we've seen, not just in the Melbourne system, but certainly in the similar systems in Brisbane and in Perth, is that the new variant. Let me rephrase. The quarantine system was one of the principles of the quarantine system, in my language, is that the primary infection transmission risk was direct contact. Was me touching you or me touching surfaces that you had touched where you are not. So the design was all based around removing that physical contact between people. What we are seeing with the new variants, the B117 UK variant, the South African variants, is that they have a far greater ability to transmit by aerosol spray. And I think Simon covered some of this at the beginning of the conversation. And that's what we've seen in the three exchanges of this new variant in the Melbourne system in the last 10 days, 2 weeks. Once at the Grand Hyatt, once at the Park Royal, and now at the Holiday Inn. And bluntly, we designed hotel quarantine systems to deal with aerosol transmission at the effectivity that we've seen here. That is a challenge for us in terms of a new virus. That is a challenge for us, a new variant. I think there's no look, let's put it this way. There's no doubt that all of this is playing out in the full public gaze. All of this, all of us are now experiencing the consequences of that. I'm confident that we are doing everything we need to get this new outbreak under control, and we'll see over the next few days how well that goes. And I think it will lead to some very, very difficult decisions around hotel quarantine going forward in terms of how we manage that risk. And I don't say that lightly. It would have been, look, it would have been probably, it would have been, let me talk about trust in a different way. It would have been very tempting maybe for some of us to have said, well, we won't go into lockdown. We'll just try and keep this one under control. We'll just run around really hard because we don't want to admit that there's a problem. What we've had to do on Friday is to say this is actually a significant threat to the whole Victorian community. We're not going to gamble that we can get. I'm very confident in our testing and isolation and contact tracing systems, but I'm not willing to gamble with the health of all Victorians. And I would rather eat humble pie in the face of the 200 people on this call and 6 million people saying we thought you had this under control, because I think it's just too important. But it will rightly lead to a very high public expectation that says we can't do all this again. And I think there will have to be significant changes made again. The final thing I'd say is, is that the whole world is struggling with this. The whole world is struggling with how not only the original COVID-19, but these new variants. Everyone's having to adjust their thinking and their approach to it, as do we. We have to adjust and think that too. We've managed to preserve Australia's, as an Australian conversation, Australia's largely COVID-free status with sheer bloody hard work, with sharp lockdowns here and there, and a very painful year last year. And I think we're all the only thing that's really important to us is getting back to that and holding it. But recognise we're holding a dam back around the rest of the world, because the rest of the world is having a really, really hard time, and we don't want to have that here. I hope that answers.
Yep, thank you, Minister.
Yes.
Thanks, Mark. And that was a really great question. Thanks for asking. I've got a comment in the chat, Jerome, for you. Thanks for the straight answers. So passing that one on. Someone's asked if members of the public are concerned about behaviours in the public in a hotel or food and beverage venues or any other public venue, how could they report that or let the department know about that?
That's a good question, Mia. I think there's a look. I think the COVID hotline would be the place I would go to. There's a COVID hotline reporting function somewhere.
Yeah,
I've got other getting information in, but yeah, I'd go to the COVID hotline.
Yep, great. And I'll get my team to put that COVID hotline and the instructions into the chat. I'm conscious that there's quite a lot of questions here. I'm conscious that Charles Cisse has a question. Would you like to ask your question, Charles? And then we might wrap up if that's okay. And what we'll do is just collate those last questions and try and send out some information to some of our service provider partners. Charles,
thanks, Mia. Yeah, thanks, Mia. My question is, are there going to be any stiff restrictions for people who refuse the vaccine?
That was about, Charles, was that about, will there be any restrictions for people who refuse to get vaccinated?
Yes, who refuse?
Yes.
Yeah, who refuse to get vaccinated? Yeah.
Yeah, Charles, it's a really good question. I think it's a bit too early to tell, if I'm honest. So I think we haven't started yet. I think if I look at we do regular we have regular conversations like this, and we do regular surveys of what people's expectations are and intentions around vaccination. And I haven't got the numbers in front of me, but what we tend to find is that, you know, 3/4 of people essentially say, yeah, please, when, you know, as soon as you can, please get it in me, to varying degrees of enthusiasm. And we have around 15-20% of people who are, I'd like to know a bit more about how this really works and what it's going to mean for me, or I've got concerns about, you know, I've got concerns about I'm pregnant, I'm concerned about my child, etc., etc., etc. But they'll still do it. And then there's about 5% who, for various reasons, just don't want to go there. If I'm really honest, my focus is going to be on the 95% that just want to get it. And I think our problem or our challenge to start with is let's protect themselves and protect the wider community. At some point, we will then get to I think a fairly small hard core of people who, for whatever reason, don't want to go there, and we'll find a way of dealing with that. It goes a bit back to Mark's question. The point of this is we don't want to be draconian about it. We just want to make sure that we protect as many people as we can, as quickly as we can. And we do need to get to a herd immunity, because we don't want to keep going through lockdowns. If we're in a world where we still have large numbers of vulnerable people who are not vaccinated, then as a society, we keep having to do this painful down on off stuff in order to get some of our lives back. And I think most of us will just say, can we just move on? Let's get vaccinated. If it's like a flu jab, it's like a flu jab. And absolutely recognize that for some people that needs a more detailed conversation with their physician or with someone else. And we'll be very happy to have those conversations.
Thanks, Jerome.
Thanks, Chelsea.
Look, I'm really conscious that we're very much very close to being out of time, and I want to thank you all for your questions. They've been really great. I'm really sorry to the people whose questions we didn't get to. I wondered, Philip, if you wanted to provide any very quick closing remarks before we close out, or Jerome, if you wanted to provide anything before we finish up.
I think, Philip, if you would mind doing a summary. I mean, I just want to say thank you so much, everybody, for dialing in. I know it's a beautiful sunny day out there, and that said, nobody can go out anyway. So maybe this is the best thing we've got to do with our time. But thank you for your time and your support. And the only message I would say is we want to use the next 3 days to get as many people tested as we possibly can, so we really have a good understanding of any onward transmission. So if there's people in your network who you're concerned about, please encourage them to get tested. It would.
Terrific. Look, I don't think I've got anything more to add other than, yes, just enjoy the sunshine outside, I think, and take some time to recover and enjoy the Sunday.
Great, thanks, Philip. Now, Jeremy Hearn has indicated that he could leave the Zoom open. Jerome will need to leave us. Can I reiterate Jerome's call to please get tested if you have even the mildest of symptoms. Stay home and stay safe. And thanks very much for your time. Thank you, Jerome, for being here.
Thank you all, and thank you, Mia.
See you later.
Thank you.